Welcome to Lilac Dance.
A podcast by two disabled people about creative expression and processing emotions.
My name is Elena. I am a white woman with brown eyes and shoulder length brown hair with blonde highlights, and I'm wearing a black t-shirt with some white, like a white collar and white around the sleeves.
And my name is Heather, and I am a white person with strawberry blonde hair. I'm wearing a pink halter top tank top, and I have earrings on that are
Oh, those are pretty.
like fake diamonds. So today we're talking a little bit about my experience with my health and the healthcare system. And this is a conversation pre me going to Mayo Clinic for my health in Minnesota.
Yeah. So I don't know. Do you want to tell us maybe a little bit about your history of why you're going to the Mayo Clinic?
Yeah, absolutely. So my pain history starts when I'm 8 years old and I had some migraines, but the migraines were manageable by medication and they weren't very often. And then when I was 11 years old, I was in a car accident and I was diagnosed with a mild traumatic brain injury, mild TBI. And I experienced chronic pain in my upper back, my neck, and my head. And I pretty much had a migraine start when I was in the car accident that then turned into what's called an intractable migraine that never really stopped. So I lived many, many years with like really chronic headaches and migraines and neck and shoulder pain. And I still was able to dance, and I was able to dance standing. And for me, that was really important. And even if I did have a headache, I would still somehow dance because I loved it. But then when I was 20 years old in 2019, I injured myself dancing, and I injured my sacroiliac joint in my right lower back, and I had chronic lower back pain, and basically I lost my ability to go upstairs. I lost the ability to walk long distances without pain. I lost the ability to sit upright without pain, just to sit in a chair, which we do many times in a day. So my life really changed at that point. At this point, I had already been diagnosed with depression that was very much related to the pain. But then I found myself, the pandemic started, and I had like not only all this problems from this car accident when I was a kid, but I had this new injury, and like navigating that was really difficult. So I was like, honestly, I spent a year like mostly in bed, but sometimes being pushed in a wheelchair. And then ever since then, it's been 4.5 years now, evolving since that injury. I slowly began to walk more, slowly began to sit up more. So now I'm in like a totally different place, but I definitely want to touch in with what I'm feeling like now. But that is a bit of the history.
Wow, that sounds really hard to not be able to, really do much walking or movement at all for a year. That's really tough.
Yeah, it was really hard and depressing. And I wasn't even on antidepressants at that point. I had so much trauma from the healthcare system, basically just them saying, I was never really told, well, you must not be in pain, because I had like a very clear causal incident for why I would be in pain. Like I was believed to an extent, but I wasn't necessarily validated about how hard it was to live my life, and I wasn't necessarily told that there were options for me.
Yes.
I was like given medication after medication, but it wasn't like, okay, here's what we're going to do and this is going to work. It was like we're doing very experimental things and we don't know what's going to happen. And so by the time I was age 20 with my lower body injury, I was like why would any doctor be able to help me? They're just going to throw medications at me, and this is serious. But how would they be able to help something serious?
Right.
And it was the pandemic, so it was like, I'm not going to be able to get scheduled anywhere. And I had bad experiences with physical therapy in the past because they would tell me, oh, you just need to stretch and strengthen.
Mm-hmm.
Well, I don't think that's necessarily true if you have an injured muscle that didn't ever recover from injury.
Right.
I think it's different if you're a mostly non-disabled person and you have something happen to you, maybe stretching and strengthening can help. But if you have compounded traumatic injury in the body and you're just told to lift some weights, like that's crazy. So yeah, that's
Yeah, I mean, that sounds so hard. Was there anything else that was difficult about navigating the healthcare
Mm.
system, or was that kind of like the main challenge?
I think on one end it was ADHD makes making appointments difficult,
Mm,
and showing up to appointments can be difficult. Luckily, a lot of times growing up, I had my family supporting me, so I wouldn't necessarily miss appointments. But when it came to like, okay, now it's time to check in with that doctor and tell them that maybe the meds didn't work, I
mhm.
would like skip that because I think my ADHD was impacting me, like having a lot of like mental barriers and
Yeah,
trauma because I was like, I don't know, like how much these doctors like can really help me
yeah.
and whatnot. So it was like trauma and ADHD, but then it became physical health barriers. Like I for a while I couldn't drive myself. So like
Mm,
how am I gonna get to this appointment? It was an issue. And I know that's an issue for many people that use public transportation. Like, can I get to my appointments on time?
mm,
Um, and then yeah, just arrogant or ignorant doctors is the hard part.
mm.
Like I still have a doctor who I see currently who was kind of like a little bit odd about me going to Mayo Clinic
Wow.
because he wants to be the best at what he does. And he
Wow.
sees it as a little bit of a threat. At least that's my interpretation. And my physical therapist sort of validated that because
Hmm.
he knows this doctor. And he's like, you know what? Yeah, that doctor is a little bit, he is who he is. And it's okay. It's just you have to be aware that like doctors'
Right.
personalities influence the way that they treat you.
Well, and that's kind of awful along the way. It seems like doctors should want their patients to get the care they need wherever they're able to get that from, regardless of whether or not it's them or a different person. Like
That's
that should be
what
their
I'm
main
saying.
priority. Yeah.
Excuse me. No, it's so true. Like it should be their priority. And he's not against it. He just had something to say.
Okay. Well,
He wasn't like you shouldn't go. It was more of, well, if they invented a new technology for surgery, of course they're going to want to do the surgery on you. It's like, okay, why did you have to say that?
I mean, it's at least worth going to hear what they have to say, right?
That's
Like,
what I'm saying.
yeah.
Like I'm at a point where my health is impacted so much in my daily life that
Mhm.
I want to know what these world-renowned healthcare professionals can offer me.
Yeah. Well, and it sounds like you've seen a lot of doctors and been through a lot with the medical system already. So if there's somebody else who could help, I mean, a lot of what you're saying, I feel like I got maybe the tiniest little taste of what you're talking
Right.
about. Because, when I was, going through the health system and around 2020 as well, where in my case, it was that I had doctors who did not understand my specific illness that was kind of an intersection of mental and physical health problems. And
Mhm.
they just did not know that condition. They didn't know what was going on. And they were just very confused, didn't know how to help me. They were like, well, you're probably fine, just do this and then like it'll be all better. And I was like, I can't do this. My brain
Right.
won't let me. So it's kind of like, I don't know. It
Yeah.
reminds me a lot of that.
Yeah, for sure. And a lot of it is like I wish a doctor would give more lifestyle advice, and I
Mhm.
just don't think that they do. Like I wish if they didn't, if nothing else, if all they knew was that daily life is hard, they could then be like, okay, how many hours are you working? Oh, you're working 30? Let's cut it in half. Let's do
Yeah.
15. Okay. How many hours are you sleeping? Okay. I mean, they do that, the sleep one, to an extent.
Mm-hmm.
They know to ask about sleep, but I don't think they look at um the amount that you work or the position that you work in. Are you working an office job? Are you working a job of physical labor? Like, what
Right.
is it? Because my physical therapist recently, and I finally have a good physical therapist, like, he doesn't make me lift weights for no reason. So we're in a good place. He aligns
Oh
me,
my
and he,
gosh.
when like my neck is locked in a few places, he helps like readjust, and it's more like maintenance-y. It's not
Yeah.
like he's solving my chronic pain condition from start to finish, but he like actually listens.
Mm-hmm.
Go ahead.
It's difficult to imagine a physical therapist having someone come in with chronic pain and being like, maybe you should try lifting weights. Like, that's just like, I'm not a physical therapist, but that just sounds ridiculous, even to me who knows nothing about this. So
Yeah.
yeah, that's a pretty wild story. But I'm glad you found someone who didn't do that.
Yeah, he's good. And now my diagnosis is like complex regional pain syndrome because I
Hmm.
have pain in my arms, pain in my hands, pretty much everywhere in my body other than like my legs are like kind of better, but I still have sore legs. Pretty much everywhere from like my butt to my head, like
Hmm.
it's really messed up. Like even in my
Yeah.
chest, like you can touch my chest and I'll be like, ow, 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 ow.
Hmm.
And like in certain places in my armpits, it's really bad.
Yeah.
Um, the neck, the shoulders, like has that trauma since the car accident when I was a kid, plus like compounded
Mm.
issues. So, and another question I get a lot is like, what is your arm and hand pain from? And all I have to say is like, it's an extension of everything else going wrong.
Hmm.
It started when I was dealing with chronic stress in college.
Yeah.
And I was just like, oh, essentially office jobs or student work doesn't work for me. And
Right.
it sucks because I'm in a position where I'm in an office job. And now I remember a point that I was going to make earlier about like physical therapists and like doctors and like lifestyle management is that I think they're afraid to say do less. And I think that comes from our culture.
Yeah.
They're afraid to say do less because they know that you need to pay the bills. And how are you going to pay the bills? And then
Right.
getting on government disability is a whole nother process. But the truth is that you can't have more than $2,000 in your bank account when you apply for disability. It's like really limiting in what disability can do, and you have to apply with a lawyer about 2 to 3 times to get through. So that's not something I want to do personally. And when I can make about 1,000 a month working 15 hours a week, that's like I'm like, okay, like that's where I'm at. But I've
Yeah.
never had a doctor be like, let's really look at this until my physical therapist. I told my physical therapist I went up to working 29 hours because the job demanded it.
Hmm.
And my physical therapist was like, you're only used to working 15. Like, no wonder you are struggling so
Yeah.
much. And then I saw a massage therapist recently who said, hey, like, I don't think an office job is like good for you.
Mm.
She thinks she's
Hmm.
pro movement,
Hmm.
not necessarily physical labor, but she'd be pro me being a dance teacher
Okay.
because what's ingrained into the job? Stretching.
Oh,
What
that's really
else?
interesting.
Slow movement. I don't have to be really athletic about it,
Right.
but I could. And then there's going to be some administration work that has to do with being a dance teacher. Like that's, but let's say that would be only 5 to 10 hours instead of 15
Right.
to 30. Like there's a huge difference in how I can shift my lifestyle. And I just don't think that a lot of people pay attention to that. Like my physical therapist didn't even say you should work less. He just said, wow, you've been working way more than usual. Like, you know what I
Yeah.
mean? Like it's a
Yeah.
cultural thing.
Yeah, that's really interesting. I think, it's also probably because unfortunately, like people have to work in order to be able to, to meet your like life necessities and to be able to have, what you need for basic needs. So I think, it might also be like I would imagine a good doctor who had any amount of like concern for human beings might realize that as well. And I'm sure that lots of doctors probably want to tell people like maybe you should work less, but like maybe it's not even on their radar that could be an option.
Yeah, I don't think it's on their radar.
Yeah.
That's really unfortunate. We're up against a lot when you're disabled in a culture that says, well, really, you should work 40 hours. It's like,
and the doctors might be taking that as given too. Like
they
wouldn't
probably
even
are.
yeah.
It's not in their training to
Right.
say, hey, I think you should only work 10 hours. Let me connect you with these community resources so that you can make your rent still.
And
that you can have food.
Like, they should be doing that. Like
they should be.
yeah.
I mean, it comes back to like, what is the role of a doctor? And we could dive into that for another hour of a session.
I know. Well, and I will say that's kind of like what we're being trained to do in a lot of our classes as social work students. And like we had a whole exercise where we had all these different people with different sets of needs, and there's a little description of each of them, and we have to decide what resources to give them, like what funding like we should tell them to apply for. Like so we are trained to do that.
So what you're saying is that someone should refer me to a social worker.
I don't know. I mean, everybody has different specialties and everything like that. Even within that field, I don't even know. But, in the intro level classes, we do take some classes that cover like the macro level social issues kind of things. And those are the things that people who are working in more community organizing positions do for people. So, yeah.
Really cool. Wow. And then the other role of a healthcare provider that is a little bit more focused on lifestyle management would be an occupational therapist, which is what my mom does. But I think that I'd seen an occupational therapist when I was basically in bed for a year, and I was like doing school while I was in bed, and I was like, look, like my eyes and my head hurt, and like I can't get through assignments, I can't do this. And they were like, let's teach you some brain breaks, like let's teach you how to trace your eyes along a figure eight so that your eye muscles reset in between assignments. Like it was like really good strategies for self-care that they were teaching me. And it's just unfortunate because a lot of people are going to see a doctor and never get referred to a social worker and never get referred to an occupational therapist. So like there's a reason that we have so many different healthcare providers. Like not everyone can do everything, but when they don't communicate and they don't talk, and especially because people's main point of contact is a doctor, it's just unfortunate when you don't see a doctor connecting people to what they need, because a lot of people need to work less and a lot of people need self-care strategies.
Absolutely. I mean, and even like within, all these different fields, like not everybody is able to provide the same kind of information. Like, even if they're trying to achieve the same goal, like you could go to someone who is a social worker in training, or in terms of their training, not in training, don't do that. We're not ready, but in terms of their training, they're a social worker, and they could give you, lots of helpful tips about how to rest your brain and stuff, but they're not going to have the context that someone like an occupational therapist would, of like, here's what's physically going on with your eyes and your brain. Like, so it's so important to have so many different perspectives for that reason, because not everybody has the same expertise to offer.
Yes, absolutely. And then just thinking about multiple healthcare providers, it reminds me why I'm going to Mayo Clinic now. And it has to do with health insurance.
Yeah.
So I'm 25. You can only be on your parents' health insurance until you're 26. So I'm on my mom's health insurance, and fingers crossed. And I say fingers crossed, we checked with the insurance company that they're going to cover this. But you always have to say fingers crossed with insurance, because they could deny anything.
Insurance is so stressful. I can't even imagine having to deal with that like on a regular basis if you're going to a lot of doctors.
And so, so basically now I'm up to get surgery. Potentially. We're consulting about surgery of my SI joint.
Yeah.
And we're going to have to do it as soon as possible, because then if there's extra care after the surgery, we need to squeeze it all into 1 year. It sucks.
That sucks. Yeah. I mean, nobody should be, in a perfect world, nobody should be denied healthcare based on their insurance situation or like have to rush through their treatment because of insurance stuff. Like that is really a flaw in our system.
It's really messed up. And like I'll probably apply for Medicaid after I turned 26 because I only make 16,000 a year, because I can only work 15 hours a week. And that's just what it is. And so I have no idea what that health experience will be like beyond age 25. Like it's scary to think about, but I also want to identify how privileged it is that my mom has good health insurance, because a lot of that is white privilege, and like she was in her generation, she was able to become an occupational therapist, work for a good healthcare system and get health insurance and then have kids and then pass on the health insurance. Like that's like a very systemic reason that my family has good health insurance, but a lot of people don't. And again, that maybe comes back to the social worker that needs to point someone in the direction of applying for funding for healthcare. But the fact that you have to apply for funding for healthcare, what if you need the healthcare in that moment?
Yeah, because that takes time too. That's a whole like crazy, like go through lots of hoops and everything like that. And when people have a health emergency, it's not like, well, I can wait for a couple months, like no problem.
Exactly.
So I guess that brings, that sort of brings up the question, like, what are you hoping will come of going to the Mayo Clinic?
I think I have high expectations, to be honest. And the reason for high expectations is because Mayo Clinic is world renowned. And it's like, well, is this all talk, or are you going to walk the walk? Like,
is it going to live up to the hype?
Is it going to live up to the hype is the question. And here's something to say about Mayo. You have to apply to different departments in Mayo Clinic. So I have had to apply to the orthopedic like surgeon department for, it's called the SI joint clinic. So there is a clinic for this one joint in your body that a lot of bad things can happen to that joint. So there's like a one clinic for it, and it's within the orthopedic surgeon department, and it's called the SI joint clinic. So I applied and I got accepted. Now, the fact that you have to apply to a doctor's appointment is like a whole nother conversation.
Yeah.
Well, then I applied for my chronic regional pain syndrome, which is the I'm gonna call it a working diagnosis.
Yeah.
For all that I'm experiencing that isn't my SI joint in my body. And I was denied. And that department was the pain management department with like occupational and physical therapists. So I was denied from that department. And so I was talking to my dad and his wife, and I was saying like, I'm scared that the doctor isn't gonna consider all of my pain issues.
Yeah.
And when I told them that I had been denied for the other pain issues, they were like, lower your expectations. Because if that's the way their system works, you have to apply for one thing, apply for another, get accepted on one, get denied on another. Why would you show up and have them look at your whole body? So that's kind of where I'm at, is like, I think I need to lower my expectations a little bit, but my highest expectation is that this doctor says, okay, let's talk about what we can do for your SI joint first and foremost, because that's your worst place of pain. Like you can't do stairs. It's hard for you to sit down without pain, and it's hard for you to walk without pain. Okay, so let's take that first. I hope he says next, whether it's a couple appointments away or a day away, I hope he says next, I think we need to do X, Y, and Z for your other pain. Or I need to refer you here for your other pain. That's my highest expectation. I don't know that it's going to be met. And that sucks.
I really hope that happens for you. I mean, in terms of all of those things that, you might be able to be helped by one doctor, might need, other people, like what diagnoses have you been given over the years?
So like when I was first diagnosed after my car accident. It was a concussion and it was post-concussion syndrome.
Mm-hmm.
And then it was mild brain injury. And all this was like all together.
Mm-hmm.
And then it was intractable migraine, which actually that diagnosis I didn't even get till I was like 19. But like I've been having it since I was 11. And then I've been given, one doctor thought I had Ehlers-Danlos syndrome, but I don't, because that affects like your heart rate can be affected in a lot of things that I don't have, but I do have hypermobility syndrome. That's another diagnosis.
Okay.
Where I'm hypermobile, so like my joints move around too much, I think. I've been given central pain syndrome and complex regional pain syndrome, and I could not tell you the difference between the two, and sometimes I use them interchangeably, which is probably not right, but that goes to show like how our healthcare system is.
Yeah. And I mean, that probably also partly comes back to insurance a little bit too.
Probably.
It's like, we have to put a label on this, so
Yes.
it's gonna be this. Like,
instead of like Heather's diagnosis is she's been injured many times, she has compounded trauma,
Right.
she has this and this.
It's way
It's just like,
more
well,
complicated.
she's got like central pain or like complex pain. It's
Yeah.
like one of the two. But what's agreed upon is that my nervous system is off the charts, signaling every which way that there needs to be pain in my body. Like my nervous system at the center of making the muscles contract. All my muscles are like extra contracted all the time.
Oh wow.
Which is muscular tension, which causes lots of pain. And so what's agreed upon is like your nervous system is involved, which is I think related to the central pain syndrome diagnosis. Central pain being coming from the central nervous system. Again, a doctor might listen to this and be like, she's really wrong. So I'm not a doctor. Let's just say that. I'm speaking
you
from
the sense of what's happening in your body.
I'm speaking from the patient perspective for sure.
Yeah, absolutely.
So honestly, I think that's it in terms of what I wanted to cover pre-Mayo Clinic. We are going to do a podcast again post-Mayo Clinic where I will share about what my experience was like with those doctors. And I really look forward to being able to share that.
Yeah, I look forward to hearing about that too. And I really hope everything goes well and that they're able to help you.
Thank you so much. And thank you all for listening. Until next time.
Bye.